thank all of you for joining us this morning for the Hamptons Institute Spring Awakening. This time a year ago, we were very much in the formative stages of deciding how to bring forward the main issues of the day and to bring it to the Hamptons community. And I'm delighted that we had such a successful event last summer and again today. There's so many people to thank, but I particularly want to thank Ellen Chesler, who's my partner in crime, who has been successful in bringing a number of the participants to life. And this has been a collaborative effort with the Roosevelt Institute, where Ellen resides at this point. We're delighted to have so many of you here this morning for this off-season event, and we are proud of the fact that we've been able to successfully bring such topical issues to you both last summer and today. As you may remember, last summer we had Elizabeth Warren here, and you couldn't open a newspaper for the next 3 months without seeing a picture of her or a story about her, and particularly about the Consumer Protection Agency. Well, this year, of course, we have the budget to talk about, and we're so lucky to have Peter Orszag here on our first panel, who was Obama's first OMB director. So we're very, very excited to hear about him. Now, I have 2 resumes here for Peter and for Jeff Madrick, and it would take me about a half hour to read them because there's so many accomplishments. I will definitely give you a condensed version. Peter is currently the vice chairman of the Global Banking at Citigroup and a member of the Senior Strategic Advisory Group there. He is also an adjunct senior fellow at the Council of Foreign Relations. Prior to joining Citigroup in January of this year, he served as a distinguished visiting fellow at the Council on Foreign Relations and a contributing columnist at the New York Times. Dr. Orszag previously served, as I mentioned, the director of the OMB from January of 2009 until the middle of 2010. In that cabinet-level role, he oversaw the administration's budget policy, coordinated the implementation of major policy initiatives throughout the federal government, and reviewed federal regulatory action, among other responsibilities. From January 2007 to December 2008, Dr. Orszag was the director of the CBO, and supervising the agency's work in providing objective, nonpartisan, and timely analyses of economic and budgetary issues. Under his leadership, the agency significantly expanded its focus on areas such as healthcare and climate change. He graduated summa cum laude in economics from Princeton University and obtained a PhD in economics from the London School of Economics, which he attended as a Marshall Scholar. I want to welcome him. And then, as some of you know, unfortunately, Steve Croft called us during the middle of the week and said that he had an urgent project for Sunday's show and had to ask for forgiveness and was unable to come. And we want to thank Professor Jeff Madrick, who at the last minute was able to substitute. As you may recall, he was here last summer as one of the moderators and did a fantastic job. And we were able to prevail on him to come out today. So we want to thank him particularly for being a last-minute substitute. Jeff is a regular contributor to the New York Review of Books and a former economics columnist for the New York Times. He's editor of the Challenge magazine, visiting professor of humanities at the Cooper Union, and senior fellow at the Schwartz Center for Economic Policy Analysis at the New School. Jeff is a fellow of the World Policy Institute and the Century Foundation. From the 1970s to the 1990s, Madrick had several positions in journalism, including serving as Wall Street editor of Money Magazine, finance editor of Business Week magazine, and an NBC News reporter and commentator. His awards included an Emmy and a Page One Award. He graduated from New York University and Harvard University and was a Shorenstein Fellow at Harvard. His latest book, although there's one coming up, The Case for Big Government, was named one of the 2009 Penn Galbraith Nonfiction Award finalists. He's at work on a history of the U.S. economy since 1970 to be published very shortly. Join me in welcoming our 2 panelists. Thank you very much for coming again.
mics were probably on while we were whispering backstage. It's nice to see you all. Thank you. I don't know if Mickey mentioned that I'm, of course, a senior fellow of the Roosevelt Institute. There are so many bios floating around after a while. You never know which one picks up, but we couldn't quite hear it back there. I'm delighted to be here for the spring awakening of the Hamptons Institute. I know everybody in the Hamptons is always ahead of time, and judging by the weather outside, you've beat the clock once again. It seems to me to be winter still in East Hampton. Thank you for inviting us nevertheless. Delighted to have Peter here. Peter has been the go-to guy, or one of the 2 or 3 go-to economics guys for the Democratic Party for so long now that you'd think he was reaching retirement age. In fact, his career seems to be just blossoming at the moment. So I'm delighted to be here, and I know everybody is delighted to have you here, Peter. My goal today is to clarify to help clarify through Peter what is a very confusing financial situation. It seems that everybody believes we're in crisis. It seems we face a lot of political fighting in Washington that may, in the end, damage the nation very well. Peter was, for a long time with the Obama administration, on the inside of all these arguments. And I want to begin, as I mentioned to him, with this debt ceiling battle, because it seems to be the most imminent threat right now. Could you explain a little bit why not lifting the debt ceiling could be so dangerous to the U.S. economy?
Sure. I mean, basically, if we, and I'm going to clarify in a moment what I mean by reaching this point, but if we reach the point at which that ceiling is binding, the federal government would not be allowed to issue any debt on a net basis. And what that means is, as you all know, right now, spending is much higher than revenue, and you finance the difference by issuing additional debt. If you can't do that, you have to immediately reduce spending to the level of incoming revenue and or suspend payments on the outstanding debt that already exists, either of which would be catastrophic. We are at a point in the economic recovery where we are just sort of on the upturn. At least we're not declining dramatically, and economic growth is, while not as strong as anyone would like, and I hope we get to this later, I still have some concerns about the level of economic activity. At least it's positive. If we actually go over the edge on the debt ceiling and trigger that catastrophic set of outcomes, we will have substantially endangered this recovery and very well may throw the economy back into recession. It is not anything that one wants to play around with. Now, it's also the case that many people are confused because it seems like we just went to the edge on some budget battle and now we're going to have another one. These two things are much different. What we just reached agreement on was setting part of that spending threshold, spending level, for this fiscal year. And if there had not been agreement, the government would have to stop non-essential operations. The debt ceiling is a different thing. It's because basically there's not such a hard and fast cliff. Instead, what's going to happen is, according to the Secretary of the Treasury, in mid-May, he will have to start deploying some emergency measures to avoid bumping up against this debt cap. And throughout June, there will be more and more desperation in the degree of, in the types of measures he's deploying. And perhaps by July, you will really have to be taking exceptional measures to avoid bumping up against that cap. So it's not like there is a drop-dead date. It's just you move up this curve of increasing desperation in which the Secretary of the Treasury is twisting himself in a pretzel in order to avoid bumping up against that constraint. And in the meanwhile, there is growing concern in financial markets and elsewhere about whether you will actually avoid hitting that cap.
How do you read the politics of it? Are we ready for a serious showdown, or is this just talk right now?
I don't think we will raise the debt ceiling without experiencing some temporary turbulence in financial markets. And the reason I say that is that look, one of the things that we have to, I should immediately say, but we will raise the debt ceiling after experiencing that. temporary turbulence, just in case there's any misinterpretation. We are living in an era of heightened polarization. If you look at, and it's not just a loose impression, if you look at quantitative metrics of the degree of polarization in the political system, pretty low around World War II. They started rising in the mid to late 1970s. It's now higher than it's ever been in recorded history. So the probability, for example, that a Republican in Congress will vote with the Democrats or a Democrat in Congress will vote with the Republicans is now lower than it's been on record. And this is driven by lots of things. By the way, I just read a very interesting book that was recommended to me by a Roosevelt Institute person, Bo Cutter, called The Big Sort, not The Big Short, but The Big Sort, about how we are increasingly segregating ourselves residentially by political party in the United States. So Republicans are increasingly living in Republican neighborhoods, Democrats living in Democratic neighborhoods. For example, if you look at counties in the United States, so this is not gerrymandering, this is not congressional redistricting. Counties in the United States, in 1970s presidential elections, 25% of the American population lived in a county that swung hard one way or another in a presidential election. So 75% of us lived in mixed counties. Now, well over half of us live in counties that swing hard one way or another, which means under half of us live in mixed counties. And all of the social psychology shows that when you put like-minded people together, they go to the extreme. In study after study, because you only hear one perspective and because you want to prove that you're a true member of the tribe, you go to extremes. And that then is exacerbated by gerrymandering, it's exacerbated by the blogosphere and the cable news feedback loops, and we've got a political system now that is hyper-polarized. That is at the core of the problem over the raising the debt ceiling. It's at the core of the problem over raising or addressing many of the issues that we face. We were never so great at dealing with gradual long-term problems before they were crises, and this makes it a lot worse.
When you say there could be financial turbulence before a pact is reached, or in other words, maybe the actual reality of financial turbulence will force an agreement on Congress with the president. Explain a little bit what you mean by financial turbulence.
Well, the leading indicator will be increased chatter on, CNBC with everyone, blah, 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 blah. And then some uptick, which, it's so surprising, right? Some uptick in bond yields, in particular, Treasury yields. I think the analogy here is don't forget what happened when TARP was enacted. The bill actually failed the first time through the House. And it's only after there was a severe financial market response to that pressure that it was then enacted. Similarly here, look, I mean, another way of putting it is, in the president's speech, he said that he's appointing the vice president to conduct some negotiations with the goal of reaching agreement by June. Now combine that with the statement the Treasury Secretary has already made that by mid-May he has to start deploying emergency measures. There is no chance in my mind that we're going to reach an agreement here before emergency measures are being deployed. And as those are increasingly deployed, financial markets are going to start getting a little bit more skittish. There's increasing attention being paid to this issue. I think the experience with the government shutdown, interestingly, two points on that. The first is I think it was unfortunate that these two different budget battles, one over the discretionary budget where we just dodged a bullet and the debt limit, that they weren't combined, because we just agreed to, depending on your accounting, $20 to $40 billion in spending reductions. And those would have been useful to grease the wheels for the debt limit increase, to bring some people who are worried about our fiscal trajectory along to vote for a debt limit increase. But now those reductions are pocketed and we're on to the next debate and they don't really count. And that's probably unfortunate. The second thing about what we just went through is, I hate to say this, but it's probably unfortunate that we didn't actually temporarily go over the cliff on the government shutdown. And the reason is policymakers then would have experienced the full backlash of the American public saying, what are you guys doing? And instead, we didn't experience that. It would have been useful to have gotten that out of the way on with the training wheels on the thing that's less important, rather than on the debt limit, which is more important. And unfortunately, that didn't happen.
Did it escape the president's attention that we could have combined the two issues?
I don't know. You'll have to ask him.
Okay. Well, I thought you might be able to ask him. So May 13th is the deadline on the debt ceiling.
Well, mid-May is
the
first deadline, and I guess that's what I wanted to express. Is it's not like there's a hard deadline here. It's more like there's just the temperature keeps getting increased.
Let's talk a little bit. Let's go back a step in and talk a little bit about the budget cutting proposals put forward, both by the Republicans and President Obama just this week. Let's talk about Paul Ryan's budget cutting proposals, which in fact the House basically voted for yesterday. Summarize, what do you think of those budget cutting proposals?
Paul Ryan is a very interesting policymaker because he actually has put his convictions down on paper in full detail. My own opinion is that the Ryan plan is a huge gift to the Democrats, and I'll explain why in a second. But it is remarkable that instead of just rhetorical flourish, the details are there on this full plan, which is bold. I mean, you have to give it that. Here's the problem with the Ryan plan. There are a couple issues. The biggest one, to my mind, is the heart of the projected reduction that he obtains, and he's correct to brag about the fact that he does achieve a significant reduction in federal expenditures over time, comes from changing the Medicare program in a fundamental way towards what's called a premium support approach, which is at its heart the embodiment of what the right has been advocating for a long time, which is consumer-directed healthcare. That the theory of the case here is the core problem in our healthcare system is that consumers do not have enough skin in the game, and if they face more of the cost themselves, they would be better shoppers, and therefore they would constrain costs. Now, there is an element of truth to that, and some more consumer skin in the game would help. But that thing by itself, that way of constraining healthcare costs is inherently limited because even under those approaches, you're always providing deep third-party insurance against very high costs. For example, under a health savings account type of approach above some threshold, $5,000 or $10,000. And the vast majority of healthcare costs are the high-cost cases. The top 5% of Medicare beneficiaries, if you rank them by cost, 43% of total Medicare spending. The top 25% of beneficiaries are 85% of cost. So these consumer-directed approaches have their biggest impact on the other 75% of beneficiaries, but they're only 15% of total cost. Now here's what's stunning about the Congressional Budget Analysis Office's analysis of the Ryan plan. Does reduce federal expenditures, as Ryan suggests. I don't think any of us would view it as a great accomplishment if you reduce federal expenditures and just shifted costs onto beneficiaries. In other words, it's just federal spending goes down by $1, beneficiary spending goes up by $1. In fact, the whole theory of the case here again is by shifting that cost, you'll get an overall reduction. That's the whole point. What the Congressional Budget Office found was not just that you have the reduction in the federal expenditure, that's what he's talking about, but that the individual expenditure not only offsets the reduction in the federal costs, but more than offsets it. Total costs go up, not down, under the Ryan plan by a lot. And the reason is that the consumer behavioral response, which is the theory of the case in that plan, again, has only got limited traction. And against that, you've got higher administrative costs through private insurance plans and less negotiating power than Medicare has because the plans are fragmented and don't have as much power with hospitals and doctors as Medicare has. By 2030, this is not me, this is the independent Congressional Budget Office. By 2030, relative to an already inflated baseline of projected healthcare costs for a 65-year-old beneficiary, the Congressional Budget Office found that all in, federal plus individual costs, under the Ryan plan, goes up by 40 to 67% relative to the already unsustainable path that we're on.
Do you have a sense of what they would be in dollar terms?
Yeah, I know in my mind the 2020 numbers, which is all-in costs of about $14,000 going up to about $20,000 by 2020. So extrapolate that for huge increases.
So it's $6,000 on average per elderly person.
By then, and then even more by 2030, huge increases because basically CBO has said there's some gain from this type of approach, but it's much more than offset by other things. That has not, the fact that you're shifting costs onto beneficiaries has gotten some attention, but I think just astonishingly devastating point that you're not even getting the desired result of restraining overall healthcare costs has not gotten very much attention, and that should and will, because right now you've now got two very different approaches to Medicare in particular. We've known, there's also a tax debate, we've known that Republicans and Democrats have different views on revenue. The president, interestingly, not only critiqued the Ryan plan, he doubled down on the approach that's embodied in the Health Act on this question. So you've now got, in addition to revenue, a very stark difference on Medicare between the president and Paul Ryan. And again, that's maybe perhaps a manifestation of the polarization that we were discussing before.
I think you make an excellent point. I think most analysts you read say Paul Ryan is cutting healthcare expenditures, but on the back of the elderly. The real analysis is
he's raising healthcare costs on the back
expenditures.
of the elderly. I mean, it is astonishing. Again, just dramatically different perspectives in this polarized environment. Now, I like Paul Ryan. I mean, it might be shocking to say this. We are actually friends, but this is to say it's radical is not an understatement.
Well, I like Karl Rove too, but.
You know what? I'm going to tell a Paul Ryan story just quickly. So Paul Ryan, just very quickly, just to give you these sorts of things don't happen very frequently in Washington. So Paul Ryan, again, was a friend of mine. Apparently, among my other flaws, I don't know how one is supposed to properly receive a phone call from a member of Congress who just won the Congressional Hunting Award, because I apparently did not respond with sufficient enthusiasm. And so Mr. Ryan then said, well, have you ever shot a gun? And now this is true. I said, well, as a matter of fact, 30 years ago, there were a bunch of Jewish kids up at summer camp pretending to be Rambo, and I was an NRA expert marksman, which is true. He paused and he said, well, that clearly was a .22. Have you ever shot a real gun? And as a result of that, the next morning, I found myself shooting an M16 rifle with Representative Paul Ryan of Wisconsin. And I realized that being the best marksman at a Jewish summer camp is sort of like saying you're the most sophisticated of the Three Stooges. I then made the mistake of going directly from the shooting range to the White House, not realizing, of course, that I had gunpowder all over my clothes. And we'll just leave the rest of the story to...
But they got you out of jail.
We're okay. I can assure you the gunpowder detection systems work at the White House.
Well, let's talk about the two other big social programs very quickly. The Paul Ryan plan for Medicaid, the federal health care plan for the poor.
Yep.
A quick analysis of that.
So what Paul Ryan does is he moves Medicaid to a block grant. That is, states get a fixed amount of money, and then basically doesn't index that block grant sufficiently to keep up with healthcare costs. So what you're doing is, right at a moment when states are facing severe fiscal strains, we've already had 400,000 state and local employees laid off. We're going to have about that many laid off over the next year or two because of ongoing operating deficits. You are loading more cost and more risk onto state governments in a way that is, I think, exactly the opposite of what one should be doing, especially when combined with no theory of the case for how healthcare costs are going to be constrained. Because if you just say, here's $100 and the beneficiaries are costing $110 and $120 over time, and there's no theory, again, of how you're going to reduce cost growth over time, I don't see how that story ends well.
Will this, on balance, do you believe, come again out of the hides of the poor?
Well, there are only two possibilities, again, if you don't constrain overall healthcare costs, and I want to come back to that in a second. State governments get reduced federal, more flexibility, but reduced federal money, basically, which is why he can show a benefit to the federal budget. But again, its cost shifting is no great shakes. That's not the objective. There are only two possibilities. Either you cut back on benefits for the people who currently are Medicaid beneficiaries, or you're cutting back on other parts of the budget and or raising taxes. I mean, so it's either going to be you're making up the money in your own budget, or you're hitting the poor. Now, one of the things that's happened over the past 20 or 30 years, it's often difficult to know just how pernicious rising healthcare costs are for our society. If I told you that 20 years ago, 30 years ago, 25 years ago, starting assistant professor salaries at Stanford and Berkeley or at UT Austin and Rice at comparable public and private schools were about at parity, and they're now 15 or 20% lower at the public universities rather than the private universities, you wouldn't immediately think that that was because of healthcare costs. But the fact of the matter is, it is. It's tied directly to the fact that Medicaid costs have been rising as a share of state budgets, that state governments therefore have been constraining appropriations for public universities. The public universities have tried to offset the reduction in appropriations by raising tuition, but 20 or 30 years ago, appropriations were twice as important as tuition in their budget, so you cut appropriations by 30%, you'd have to raise tuition by 60% to offset it, not going to happen. The result is lower spending per student and lower salaries at the public universities relative to privates, being driven by rising healthcare costs. You don't solve that problem just by cutting back the federal government's share of that program. You solve that problem by getting at the core driver of rising healthcare costs, which comes back to the point earlier about these high-cost cases. That's where the money is, and if we're going to constrain overall healthcare cost growth, which has to be the ultimate objective, you have to get at those high-cost cases, those top 25% of beneficiaries, where all the money is.
We have so much ground to cover, and we want to leave lots of time for Q&A, but...
Does that mean my answer should be shorter?
That's my way of saying
it.
Let me ask you, the Ryan plan also, at some future date, wants to do what we used to call privatize Social Security, which is give people the option to invest in private savings accounts. But let me ask you two questions within one. A quick comment about Social Security, and when would, even under his own assumptions, when would the Ryan plan supposedly balance the budget and get debt down to, debt compared to GDP, down to a level he thinks is appropriate?
Well, he does, to answer the second question first, he does show over a decade a significant reduction in the deficit relative to the path that we're on. But again, I don't think we'd actually ever implement, even if we did what he said, so take the Medicare change or the Medicaid changes, which are at the heart of that deficit reduction, those would not be sustainable. State governments cutting back on Medicaid beneficiaries or having to slash the rest of their budgets, there'd be a huge backlash from governors, and we would likely unwind the things that look like would work on paper. Similarly, on Medicare, beneficiaries' costs going up by $6,000, $7,000, $8,000 a year, you're not going to sustain that program over time.
He's also
that for a shorter answer.
Yeah, good. He's also cutting taxes. So let's talk about that in relation to President Obama's response, I think it's fair to say, to the Republican plan. Assess the Obama response, and please answer a little bit about Ryan's proposal to cut taxes versus Obama's proposal to effectively raise taxes, or at least extend taxes, at least do away with the tax cut on upper income people.
Sure. The fact of the matter is we are asking the federal government to fulfill obligations that we are not willing to raise sufficient revenue to pay for. And that's, frankly, our fault. We are not demanding, we're not willing to tolerate the revenue base that is necessary to finance what we're asking the federal government to do at this point. In the face of that, Representative Ryan does a yet more extreme thing, which is he takes the tax code and he makes it much more regressive. There's no way that you can move towards a flat rate when those at the top are paying above that flat rate without hitting the people in the middle and the bottom. It's just not possible through arithmetic. So in the face of a dramatic increase in earnings and income inequality over the past 2 or 3 decades, One of the functions of our tax code is that it functions as a progressive counterweight to that and helps to reduce after-tax income inequality. Mr. Ryan would move towards a much more regressive tax code. Now, the president has a different approach in which he would take the tax cuts above $250,000 and not continue them. My own view is we are in such a bad medium-term fiscal problem that we should take all of the tax cuts that are scheduled to expire in 2 years and let them all expire, which would merely return us to the tax code of the 1990s, not perfect by any measure, but frankly, we lived through it. It wasn't a total disaster. And it would raise enough revenue to stabilize our debt as a share of GDP over that 5 or 10 year window. And it's what happens through inertia. In other words, because the tax cuts are scheduled to expire, that's what happens by default. And it's the only 34 vote revenue increase, 34 votes in the Senate revenue option that exists. And the reason is that you need legislation to extend the tax cuts. If that legislation is vetoed by the president, you only need 34 votes to uphold the veto. There is no other 34 vote revenue increase that exists.
How much more revenue would we raise if we did away with the early 2000s Bush tax cuts?
All of them, or just the upper income ones?
All of them.
All of them, somewhere between 1 and 1.5% of GDP, of the economy, depending on exactly what you do with the alternative minimum tax. That would basically, with a little bit more spending constraint, eliminate the gap in the 5 to 10 year window between the trajectory that we're on and one that would stabilize our debt as a share of our economy.
And if we just do away with the above 250,000
it's about a third of the total.
A third of the total.
Yeah.
And just to remind people, Ryan wants to cut the top rate from 35% to 25%, which is substantially more.
Yes. Mr. Ryan would make the tax code significantly less progressive. There's just no way around it.
Let's talk a little bit about austerity economics and environment of what you say is a fairly weak economic recovery. And indeed, with gasoline prices going up and the payroll tax relief expiring early next year, we're in a somewhat dangerous period. And I know you're very committed to dealing with the budget deficit now. And I want you to explain, I think it would be helpful for you to explain why you think we should take some risk with the economy in order to deal with the financial matters now.
I don't think we have to take a risk with the economy. Look, this jobs versus austerity debate has been highly counterproductive and confused. What we need is more stimulus now and a lot more deficit reduction that's enacted now to take effect in 2 or 3 or 4 years. We have to be able to understand that timing matters, and what the economy needs now is substantially different from what the economy is going to need in 2015. This should not be a debate. So the folks who are most, let me actually go beyond that. The folks who are most worried about unemployment, and I am very worried at this point that the unemployment rate has been so high and will remain so high that we face the risk of what happened to Europe during the 1980s, which is people lose their work skills, they lose their attachment to the workforce, and we face a more permanent productivity hit because the unemployment rate remains elevated. Very salient risk. That having been said, those people who are most focused on addressing that problem almost want to downplay or deny that we also have this out-year fiscal problem. And I think what that leads to is exactly what we just had, which is inappropriately immediate fiscal austerity. Because there's less momentum and action on the out years, it gets transferred to things like the spending cuts that we just enacted for this year, which, by the way, are going to reduce growth in the second half of this year by 1/4 to 0.5% of GDP. The unemployment rate will remain, 30 or 40 basis points higher than it otherwise would because of those spending reductions. I think in part that's because without more of a storyline on the out-year fiscal problem, that desire for something gets inappropriately attached to today. So, if anything, more stimulus now, a lot more deficit reduction for 2015 to 2020.
President Obama has bought into the need for obviously agreed to those cuts. Explain a little bit what it is like in the White House under this kind of pressure. Clearly, he is not exactly adopting what you are now recommending.
Well, yeah, but I think that's out of political necessity. He does not the Republicans are in charge of the House of Representatives, and you have to get things done. So faced with the choice between letting the government shut down, which would have had more consequential damage to the economy in the short run, I think he did basically the best he could.
Let's talk a little bit about the medium-term and long-term financial issues. Clearly, the big driver, when we hear alarmism from a bunch of analysts out there, it's mostly about not even the medium term so much as beyond the medium term, driven essentially by healthcare expenditures, not driven essentially by Social Security, which roughly is expected to go up by 1 percentage point of GDP only, whereas Medicare and Medicaid, and you're the expert on these numbers, is going to go up by 5, 6, 7% of GDP, and even higher down the road.
Yep.
So the issue seems to be quite clear. The elephant in the room always seems to be, how are we going to do, and what's driving Medicare and Medicaid is the growth in healthcare expenditures, as you've been discussing to some degree. It seems to be the elephant in the room. Don't we have to deal with reforming the healthcare system directly and as soon as possible, as opposed to reforming Medicare and Medicaid in a fundamental way, as opposed to slight moderations in Medicare and Medicaid?
Yes, but let's look. You're absolutely right. Medicare and Medicaid are the key. You got 4 basic approaches to. Between now and 2050, Social Security goes from 5 to 6% of GDP. Medicare, Medicaid, other federal expenditures on health, 5.5 to 12. That's where all the growth is. You have 4 basic.
And then the interest on that
accumulates. You have 4 basic approaches to restraining healthcare costs. You can reduce prices, that is, reduce reimbursement rates for hospitals and doctors. That is blunt, temporarily effective, but not ultimately sustainable. Because if you only do it within Medicare and Medicaid, you're just shifting costs onto other parts of the system. You have to get at the intensity of services provided. Second option is direct rationing of those services, not even remotely politically viable, so I'm going to forget about it for now. The third is consumer-directed healthcare, which we've already discussed, has some traction, but limited. In fact, in the configuration that Mr. Ryan has put forward, goes in the wrong direction on that. And the final one is focusing on provider quality and incentives. Because basically, to a first approximation, the healthcare delivered in those high-cost cases where all the money is for most people what the doctor is recommending, what the provider is recommending. So it's not too hard to figure out, therefore you have to get at, if you're going to be affecting those cases, you have to get at what the doctor is recommending. And that requires a dramatic change in the information flow that doctors have and in their incentives. I would love in 5 or 10 years, and we've got some of the elements here if we actually execute on them, to be able to walk into a doctor's office with my permission, not have to fill out the annoying forms, with my permission, have the doctor be able to access my medical history electronically. For the condition that I'm going to see the doctor, have a set of questions or best practice protocols pop up on the tablet or screen to ask me about, be able to click through and see to the underlying studies to see whether my conditions warranted some variation from those protocols. And frankly, I would support, as part of that feedback loop, a change in our medical malpractice system, not in the way that's typically proposed to impose caps, but frankly, if a doctor is following the evidence-based guidelines that have been put forward by, if I go to see him for a heart condition for the American College of Cardiology or the other professional bodies, depending on the situation, I shouldn't be able to sue that doctor. The whole heart of the medical malpractice system in the United States, which is based on customary practice, which means the doctor kind of has to do what people down the hallway are doing because that defines customary practice, but it's a squishy concept, should, wherever applicable, be replaced by an evidence-based safe harbor. You're doing what a professional body suggested was best practice protocol, you can't get sued.
How much does malpractice actually add to healthcare costs, then?
Not very much, but here's the thing. Here's an example. Actually, this is very interesting. I almost never agree with practitioners as opposed to the academic literature, but on this I do. So every doctor or hospital says med-mal is killing us. Pretty much every study says not a big deal. I actually think the studies are misspecified. What the studies do is we have this huge variation across the United States in healthcare cost per beneficiary. So it's a lot more expensive in some places relative to others. By the way, the silver lining in there is we already have examples that exist, this is not hypothetical, of institutions and locations that deliver high-quality care at low cost. They exist today. You can go and visit them. So it's not some hypothetical discussion. But you look at the variation in the costs across the United States, and then you try to correlate that with the stringency of med-mal systems in the different locations, and you don't find a big correlation. What that misses is what I just mentioned, which is this emphasis on customary practice. I think basically what happens is the whole nature of the med-mal system, even in the states or localities that have, quote, generous systems, they still use customary practice. And what that means is a more intense approach somehow takes hold among a particular group of doctors, and then spreads to other doctors in that area, facilitated by the payment system that we have, which pays for more care rather than better care. In that kind of situation, whether you have a slightly higher cap or a slightly lower cap isn't really going to influence the strength of that social contagion. So I think the med-mal system does still play a significant role in the variation that we see in healthcare costs and the inefficiency in the health system, even though it's hard to detect given the way that the academic studies are framed.
I'm going to hold myself to one last question and open it up to Q&A, right, Mickey and Ellen? Public investment. I think we pretty much agree there's a public investment deficit in the nation. How do we afford public investment? Is even reversing the Bush tax cuts in total enough? In your view, do we need other tax increases as well?
Three things. The first is we need to much better allocate the funding that we already have. Too much of the money that we devote to infrastructure flows from the Congress to state-level bodies that don't then make, that are basically making political decisions rather than even, most states don't even use cost-benefit analysis in allocating infrastructure spending. So I think the biggest benefit from something like an infrastructure bank is not somehow financial wizardry creating money out of nothing, but rather that you could have much better allocation, investment decisions of the money that is already flowing. Second thing, we need to better price the infrastructure that we have so that we use what we already have more intelligently and better. And that includes our highways, and that includes our airports, where the pricing that we have is not, it's far off from what it should be. And then the final piece comes back to the revenue base. We are trying to run the federal government on a revenue base that is inadequate, frankly. And you see that manifesting itself in an infrastructure deficit along with other investment deficits also.
Well, I would